We see you, Keely. Yay!
I think I was using the wrong browser, so I think I've got it figured out now.
Awesome. Hello, everyone. Good mid-morning to you. My name is Becky McGregor, and I'm your Employee Wellness Coordinator here to help facilitate this Open Enrollment webinar, Your Benefits Unmasked. Presenting today is Cigna with Keely Hoke out of Denver. So we're going to get a little bit deeper into the Cigna plan benefits for 2021. And I want to thank you all again for joining us. And I also want to thank Andrea Biggs, one of our benefit specialists who's in the chat box, who's going to help answer questions, along with Ann Johnson. She is our senior benefit analyst, and she's also going to be in the chat box helping to ask questions. I'm going to get back to questions here in just a minute. Let me go forward here to talk about a couple of house cleaning items for us. Please make sure your phones, computer, microphones are muted. It just limits the distractions, obviously, for everyone, and especially for the presenter. It is very distracting if someone accidentally becomes unmuted. And also, if you can, turn off your camera. And when we get to the Q&A section, we're going to ask that you put those notes not in the Q&A box, but in the chat box. We had, for some odd reason, some technical issues right now with our chat box or with our Q&A box. So your questions will go right into the chat box. And please know that we are going to have a Q&A portion. So if we don't get to your question, right away, I'm going to make sure and note it. Ann's going to note it. Andrea's going to note it, and we're going to make sure it's addressed in the Q&A part of this presentation. And again, I want to thank you all, and I want to thank Keely for coming, for joining us today. And I'm going to hand it over to Keely. I'm going to just go ahead and forward the slide. Can everybody see it?
Thanks, Becky. Can you hear me okay?
Yes. Thank you.
Awesome. Hi, everyone. My name is Keely Hoke, and I'm here today from Cigna. Thanks for joining me to learn a bit more about your plan option for the upcoming year. I know we're so excited to be one of your carrier options for the upcoming plan year. One thing to note before I get started, I live in a very small apartment and deliveries are going on right now. So if you hear a dog barking, don't be alarmed. My dog just happens to hate the delivery man. So just something I wanted to note. All right, so we'll jump right in. Becky, next slide, please. Thank you. All right, so first I want to talk a little bit about our Cigna OAP, or Open Access Plus network. So, of course, by staying in network, you can save money by using doctors, hospitals, and health facilities that are part of our network. There are over 5,000 Cigna contracted providers in our OAP network, including Presbyterian, University of New Mexico, and University of New Mexico Children's Hospital. So this OAP network offers seamless nationwide access to these providers and many more. This will really simplify getting care for members who may be traveling, maybe you're working out of state, or if you have dependents who are living out of state. In short, the plan acts the same inside the state of New Mexico as it does outside the state of New Mexico. So once again, for example, if you're seeking care across state lines or a dependent is, you will be covered. All right, Becky, next slide, please. I want to really briefly do a high-level overview of your Cigna medical plan benefit offering for this upcoming year. So I have listed here, you have one plan option for the plan year, and you've got that calendar year deductible listed at the top. So it's broken down by individual and family, and this is the amount of money you'll have to pay towards medical services before the plan kicks in. Something I want to point out is that some services do not count towards the deductible. So I'll name a few examples, but please know you can find an extensive list, your benefit summaries, and all of this information on your intranet. I believe Becky put the link in the chat, so don't feel like you have to remember everything. So a few services that do not count towards your deductible include any type of preventive care visit, and that is covered 100%, so you're not paying anything out of pocket anyway. Any emergency room or urgent care facility services are other examples that do not count towards your deductible. Any laboratory services, any outpatient therapy, those do not count towards your deductible. All right, so those are just a few examples. Again, there's an extensive list, and I do believe Becky posted the link where you can access that. So moving on, under the calendar year deductible.
I'm sorry to interrupt. I really am. You kind of froze, and we didn't get to hear, I think, the last couple of seconds after laboratory services.
Oh, let's see. I think those are the last examples I said. I think I just reiterated that. Don't feel like you have to remember all of that. This information is in the benefit summary, and it's located at that link that Becky posted in the chat.
Thank you, Keely.
Yeah, thanks for letting me know. I didn't know I froze. All right, so next, below the deductible is that calendar year out-of-pocket max. So again, broken down by individual and family. And I want to point out that the out-of-pocket max is the most amount of benefits you will pay towards healthcare in a plan year. So below that, the cost for physician services, visiting your primary care physician or a specialist. Something to point out, preventive care is covered at 100% at no cost to you. Below that, for inpatient and outpatient hospital facility services, followed by the copay and what the plan will pay for emergency room urgent care, and ambulance services. And then the last three sections I have are laboratory services, radiology, and advanced radiological imaging. Next slide, please. I wanted to include a few real-life examples. I know that those really help me when thinking about healthcare costs. So I have two scenarios here. Scenario one is low to average claims costs, where all claims are below that out-of-pocket maximum. So I have this employee example first. Let's say I'm on the plan, it's just me. I have a total annual claim of $1,000. I'm going to pay that $1,000 because it's a deductible. And then there is no out-of-pocket maximum because my claims have not reached that amount. So my total spend will be $1,000. The OAP family example follows the same logic. That claim of $2,500, which is also the deductible, which my family will pay, we have not reached the out-of-pocket maximum, and so our total employee spend will be $2,500. The second scenario is above average to high claims cost, where the claims are above that out-of-pocket maximum. So the employee example, it's just me on the plan. I have a claim that's $7,000. I pay that $1,000 deductible, and then I have to pay the out-of-pocket maximum, which is $5,000. So that totals my out-of-pocket spend at $6,000. Again, the OAP family follows the same logic. So those total annual claims, I pay that, my family pays that deductible, and then we pay the out-of-pocket maximum, bringing us to $15,000 for spend. All right, next slide, please. One thing I want to point out is that employees who enroll in a plan administered by Cigna are eligible to receive a Fitbit Versa 3. So the Versa 3 pictured here, it's sleek, it's versatile, it's intuitive, it can count calories, hours slept, minutes exercised, steps taken during the day. It connects with a smartphone. So once we've verified your enrollment, you've registered on mycigna.com, we'll send you a link where you can order your Fitbit at no cost to you. Think of this Fitbit as Cigna's promise and dedication for you to be your healthiest self. We really want to help you and support you every step of the way. One thing to note, it'll be one Fitbit available per household. Next slide, please. So the phone numbers and websites I have listed here are where you can go if you want to learn more or access any Cigna tools and resources. So I want to point out that pre-effective number, 888-806, and it should be 5042. So just something to note. You can call that number if you have any questions on selecting that Cigna plan, Cigna coverage, determining if your physician or facility is within our network. So again, that's 888-806-5042. And it is typed wrong on the slide, so I just want to be sure to point that out. It's 5042. You can also visit Cigna.com and you can search for and determine if your providers or facilities are within our network. You can get your questions answered, so that's where you can go before you become a Cigna member. If you choose to become a Cigna member, once your plan goes live on January 1st, you can call that post-effective number, or you can visit mycigna.com and register, and it's really your anything and everything Cigna resource. So again, prior to January 1st is that top line, and after January 1st is that second line. Next slide, please. All right, that's it for me. Thank you so much for your time. Again, we're excited and honored to be one of your new carrier options for this plan year. If you have any questions, I will be on the remainder of the call. Please feel free to send me a chat and I will do my best to answer all your inquiries. Thanks so much.
All right. That means we are open for questions, and we'll probably help here in just a few minutes really moderate this a little bit more fully for us. But But I do believe we have some questions coming through. And again, this is your opportunity, so don't be shy. Anne did answer a good question in the chat, but I just want to make sure, Keely, we can address it for everyone. Actually, I'm just going to go to, is there a significance between Cigna and Blue Cross Blue Shield? Which Anne did answer, but if you could just also reiterate that for everyone, just in case people didn't see the answer.
Yeah, absolutely. So the big difference between Cigna and Blue Cross Blue Shield is the provider network. So we at Cigna contract with Presbyterian Hospital and providers. Blue Cross Blue Shield contracts with Lovelace hospitals and providers. With Cigna, we also have our Open Access Plus network. So you get seamless access whether you're in New Mexico or outside of it. I cannot speak to Blue Cross Blue Shield's network, but that is absolutely true for us. So that is the big difference. And there is the barking. I'm going to go on mute for a minute.
Okay.
And Becky,
yes,
Becky, I'll just elaborate on that a little bit. So one of the reasons that APS made changes for next year is we wanted to give our employees 2 PPO options and a PPO plan. Cigna is one of them. Gives you the ability to see contracted providers here in New Mexico, contracted providers throughout the United States, and also see non-contracted providers. So both the Blue Cross Blue Shield plan and the Cigna plan give you that ability. And then we're offering 2 EPO plans. An EPO plan, it stands for Exclusive Provider Organization, means you have access to New Mexico contracted providers is your network. And that applies to Presbyterian Health Plan and to True Health. For True Health, that's the way it is now. For Presbyterian Health Plan, this is a change effective January 1, 2021. So right now with Presbyterian, you do have outside of New Mexico access. That will change effective January 1. So you need to be aware of that as you're deciding on the plan that you're going to select. Always with any of the plans that you select, if you are traveling outside of New Mexico and you have a medical emergency, you always have coverage for an emergency or an urgent care visit. But you do not have coverage, for instance, if you have a child going to school in another state, you do not have just coverage for them to go for a preventive visit if you select one of the EPO plans. So Cigna might be a good option for you if you have that particular circumstance.
Okay. So we had a question about whether iAssociates is in network with Cigna. iCare Associates.
And it's actually just called iAssociates. Keely, do you have the provider network up? I'm sorry, I don't recall the answer to that question.
I do not. I don't have a list either. However, I can quickly do a search and see if I can pull it up. If you'll give me 1 minute.
Okay. And then while we do that, I think Robert had a question about, I can call the pre-effective phone number to learn if there are Cigna providers in Tacoma, Washington.
Robert, yes, you can. You can call that pre-enrollment number, or you can visit Cigna.com and do a search. I personally would recommend calling. I just like to call and talk to someone. I find it easier. But yes, you're able to do both.
No, James, can you still use my chart from Presbyterian? No, those are 2 different plans.
And actually, I'm almost certain, James, that my chart is part of Presbyterian healthcare services. So it's part of your doctor's office. It's not part of the health plan part, which gets a little confusing because they both have the same name, right? But I'm almost positive that is related to your doctor and your hospital visits at a Presbyterian facility. And yes, you will still have access to that.
I see. Oh, sorry. Go ahead.
No, go ahead. I'm sorry. Go ahead.
I was just going to say, I see a few questions as I'm looking this up. Someone asked, can you tell us what the deductibles and out-of-pocket max for out-of-network doctors? I will say I did not share that information, and only because I encourage people to stay in network, but the deductible to see an out-of-pocket or an out-of-network is out-of-network deductible for an individual is $5,000, and out-of-network for a family is $15,000. And then out-of-pocket maximum for an individual is $8,500. Out-of-pocket maximum or out-of-network out-of-pocket maximum for a family is $21,250. And again, this is listed on your plan documents on that link that Becky shared, so don't feel like you have to remember that. I know that's a lot of numbers. And then another question, do you cover chiropractic and acupuncture services? Let me take a look.
And Keely, I have that, so I can give that real quickly. So yes, chiro and acupuncture is covered on the Cigna plan in network. It's $30 per visit, and there is an annual visit limit of 20 visits for those services. So yes, you do have that coverage. I do also want to just reiterate what Keely just said. Those big numbers, $5,000, those were out of network deductibles and out of network out-of-pocket maximum. So again, most of our employees are receiving their care. We know this from historically from the reports that we get from our medical plan carriers. Most of our employees and dependents are getting their services in network.
And would you be able to tell me the name of the eye care facility again?
It's Eye Associates of New Mexico.
Eye Associates of New Mexico.
So let me just, if it's okay, Keely, I'm going to address some of these questions that are coming in unrelated to network. And some of these network questions, truly, you all may need to either call the Cigna pre-enrollment line or go on the Cigna website to find out if your doctor is contracted. This is kind of getting into a lot of detail that isn't something we necessarily have right at our fingertips. So DME is definitely covered. It is still covered at a 20% coinsurance. The deductible does not apply to DME. Prescription drug coverage is through Express Scripts. So that is true for all 4 of our medical plans. So that information is available on the Express Scripts benefit summary, which is posted on the APS webpage. We have a question. Let me just make sure I'm not missing any questions before I get to Jennifer's question.
And I'll interrupt you for a second, and I can confirm Eye Associates of New Mexico is in network.
Yay. Thank you very much, Keely. And then you'll notice you have also a question about New Mexico Orthopedics, whether or not they are in network.
Let's see. New Mexico Orthopedics.
And then I think next, Ann and Keely, we had a really great question from Jennifer about kind of explaining how the deductible works again.
Yeah, absolutely. I will say I'm not seeing New Mexico orthopedics on my search, but that doesn't mean it's not within network. I would encourage you to give that pre-enrollment line a call just to double check. So again, that number is 888-806-5042, and I'll put that in the chat. And as far as the deductible, so the question is, for example, do we pay our copays up to $1,000 for individual and then we don't have to pay anything after that? So great question. So think of your deductible as that first amount of money you have to get to when you're paying your healthcare costs. So if you have any out-of-pocket costs, they'll accumulate and you'll pay them until you get to $1,000. Once that happens, your plan will kick in, and if any co-insurance applies, you'll be responsible for a part of the bill, and Cigna will pay part of that bill. Once you get to that point, so after you've paid your deductible, then you need to continue to pay up to your calendar year out-of-pocket max. But Cigna will share those costs with you. Once you get to that out-of-pocket max, that's when you don't have to pay anything else for the remainder of the plan year. So I hope that makes sense. If it doesn't, please feel free to ask more clarifying questions in the chat, or just tell me, Keely, that made no sense.
So Keely, I think because in her comment, it was that the copays don't go toward the deductible, but it goes toward the out-of-pocket max. Just need to kind of explain that, I think, a little bit.
Yeah, I'm seeing your chat. So please explain what the copay goes towards and what it doesn't. Okay, so I'm looking at the plan documents here. And where the copay goes towards and what it doesn't. You know what? So each plan is different, and it's not clear to me on the plan documents what the copay goes towards.
So Keely, I can answer that question, and maybe you can take the next one, which is whether or not Mayo Clinic is in your network. But let me answer Jennifer's question. So on the APS plan, you will pay copays for many services. Like if you need to go to the doctor because you think you have an ear infection, or you need to go to the dermatologist, or those things will be covered at a copay. Those copays are not subject to the deductible. So you do not first have to meet the deductible before you pay those copay amounts. So when you look at the benefit summary, you'll see some things that have a dollar sign in front of them. Those are copays. You'll see other things that have a percentage sign behind them. That is when the deductible applies. You meet the deductible and then you pay co-insurance. Very similar to your car insurance, where you have to meet a deductible before the car insurance starts kicking in to help you pay for whatever happened to your car. So the deductible applies for more extensive services, such as hospitalization, inpatient services basically is where you will see the deductible and co-insurance apply. Or things like dialysis and things like that. So more expensive, extensive services is where the deductible applies. So hopefully I've clarified that.
Thank you, Anne. I think I totally misunderstood the question, so thank you for that.
And so I think the question that someone has about Mayo Clinic, just to be sure, is I think you should call and ask the pre-enrollment line if the Mayo Clinic is a contracted provider with Cigna Healthcare. If I have to guess, the answer is yes, but I am not sure of that, and it's definitely, if that's an important thing to you, then I would definitely recommend that you call the pre-enrollment line.
And I agree with that. Typically, the Mayo Clinic is within network, but I would call just to check. And I know there's different Mayo Clinic locations, so always double checking to be sure.
Okay. And then Becky is just asking us to please explain what the copay goes towards and what it doesn't. So again, your copay will apply to your out-of-pocket maximum. So if you have a year, hold on just a second. Let me close my door. Thank you. So your copays do apply towards your out-of-pocket maximum. So again, if you have a year where you have some significant health issues and you see the doctor and you have to have lab tests and you have to have, maybe an MRI, a CAT scan, whatever, and then the doctor says, you're going to need some surgery. You just have a year where, things just don't go your way. Then you will likely meet your out-of-pocket maximum. And at that point, any further medical services for the balance of the calendar year will be covered at 100%. And again, your deductible, your co-insurance amounts, and your copays all apply to your out-of-pocket maximum. What does not apply to your out-of-pocket maximum is prescription drug costs. There is a separate prescription drug out-of-pocket maximum. That information is included on the Express Scripts benefit summary. And Amber has a question. Do we still have you, Keely?
Yes, I'm still here.
Okay, so Amber just has a question about, you're right, this is an overview of all the plans, and you're asking for more detail about what is covered by each plan, Amber. So we are working with our web team to get the benefit summaries for each of the 4 medical plans posted. But benefit summaries are really a highlight. They, some of them are 2 pages long and some of them are 12 or 13 pages long. But basically on the APS plan, you have coverage for the same services on all the plans with a few very minor differences, like Rolfing is not covered by the Cigna plan. The thing that I would recommend that you look at is there is a comparison of the 4 plans that is currently posted. And then, like I said, we're working with the web team to get all of the benefit summaries posted for all of you. Jennifer has a follow-up question. Let me just read it. So I just want to clarify. So she's asking if we meet our deductible through paying co-insurance, will we still have to pay co-pays until we meet the out-of-pocket maximum? So I think we have a little bit of the cart before the horse on this question. You do not start paying any co-insurance, with one exception, which I will point out, until you have met your deductible. So again, if you're hospitalized, if you need chemotherapy or dialysis or something like that, first you will pay your deductible in the calendar year, and then you will pay co-insurance. Then that's all happened and you just need to go to your primary care doc. You're going to have a co-payment for that. All of those things apply to the out-of-pocket max. The only exception on this is co-insurance only applies to durable medical equipment. So if you need crutches or something like that, probably not the best example, but if you need durable medical equipment, you're going to pay co-insurance only. That is not subject to the deductible. I hope that clarifies, Ginger. I'm sorry, not Ginger, Jennifer. So I think we have hit all the questions in the chat box, Keely. And
Yeah, I don't see any more. I think we've got them all.
okay. And I know Becky is toggling back and forth between this meeting and the one that started at noon, and I cannot move the slides. But basically, I know there was one question that I'll just touch on briefly while we wait for Becky to rejoin us. Tomorrow is the Financial Wellness and Boost Your Budget webinars starting at 7:30 with ASI Flex. ASI Flex is our flexible spending account vendor. And so for those of you who currently participate in the flexible spending account, you all know, I hope, that you need to re-enroll each year. Your contribution for this year does not carry over into 2021. And for those of you who do not participate in the flexible spending account and just want to understand how that might be a benefit for you, help you with your budget, that webinar is at 7:30 tomorrow morning. Then at 11:30, Nucinda will be doing a webinar. At noon, the education plan, which is the 529 plan for those of you who have children who you will be sending to college at some point in time. That's a wonderful benefit that you might be interested in hearing about. And then at 3:15 tomorrow afternoon, Standard, they are our life and long-term disability vendor. They're going to be talking about some of the resources that they have that are available to all APS benefit eligible employees to like help you start writing your will and planning your estate. Just some great resources that they have available. And it looks like Becky has joined us again. Thank you, Becky. I think we've answered all the questions. So I think you can go ahead and wrap it up. I didn't go over this slide that you have showing right now. So maybe Becky had to jump back on her other call. So any information around open enrollment, again, this is on the APS internet. It's also available on the intranet for you. Extensive information was sent in the September 17th perspective. So if you have not looked at that, you might want to. Again, the financial wellness webinars are tomorrow that I just went over. Open enrollment will be a completely online process this year. So you will not be filling out paper forms if you want to make a change or need to add a coverage or add a dependent. So we will be doing webinars to go over that process with you. Those are on Monday and Tuesday next week. You'll find that information exactly where you found to get on today's webinar. And then Becky, are you back with us? Nope. So also we have it's a wellness walkthrough, basically, event Thursday and Friday, the 8th and 9th of October. This is going to be not like a typical wellness fair where people are hanging around booths. It'll be more a walkthrough, but we wanted to give people the opportunity to get their flu shots. There'll be the mammo van there. There's going to be a blood drive if any of you are blood donors. Those of you who do donate, will be able to get free COVID-19 antibody testing if you donate blood. Again, this is a hand sanitizing, mask wearing, socially distanced walkthrough for you to receive preventive health services. It's not a gathering. But we also will have available assistance for those employees who are unable to enroll online because they just don't have a computer. They have other issues enrolling online. We're hoping that those of you who are obviously very computer savvy will be able to figure out how to enroll online. Again, due to the public health order, do not come to City Center for open enrollment. If you do need assistance, that will be at Berna Fazio, which is the facility, of course, located at Louisiana and Comanche in the Northeast Heights. And we thank you all for attending today. We feel like you're a winner just because you attended. But also Becky is going to be raffling off some prizes. So she will notify you if you are one of those winners. And I see we do have one question from Carla that I will respond to real quickly. Keely, do you have any things you'd like to say as closing remarks? And Becky, are you back with us?
Thank you, everyone, for joining today. Thank you for hosting me. I am excited and honored on behalf of Cigna to be one of your plan choices for the upcoming plan year. If you have questions, don't hesitate to call that free enrollment number. I'll give it to you one more time. It's 888-806-5042. So thank you so much and have a great rest of your day. And thank you, Anne.
All right, Keely, thank you very, very much. And again, I'm going to finish off with these questions. So for anyone who's still on the call, if you want to jump in and ask a specific question, you can definitely do so now. Keely and I will be here and Andrea, to answer any of those questions. So if you want to come off mute, then you can do so. I see we have about a dozen people still on the call.